Hi everyone, welcome to another Gypsy Nurse Live. I'm Rachel, the online community manager for the Gypsy Nurse. Today we have the AMN team all here joining us live to tell you about the steps that they took to make it safe to travel by offering clinical support, providing housing, and above all, working with their clinicians to make sure that they received whatever they needed during the height of the pandemic. And they're also going to tell you about how they're continuing to support their needs as they are, continue to take travel assignments. They're going to be super helpful with those different questions. So, be sure to ask questions. They're going to answer those, anything that you guys have. So, joining us, we have Kelly right here next to me, and then Mary, Leo, Saundra, which you probably have all seen on here before. She's the host. And then Sarah. So, I'm going to go ahead and hop off and let you guys do your things. Thank you so much for coming on again. We love having you on here.
Thanks, Rachel. We are so excited to be back again. So as Rachel said, my name is Saundra. I'm a senior director at AMN, and I am thrilled to be back with you. I think this is our fourth Gypsy Nurse Live. So really, really enjoying being able to spend time, talk to you about AMN, answer all of your questions, and of course, have some really fun giveaways. So there will be more of those coming. Before I kick it off, I do want to introduce our amazing panel here. For the first time, we have our actual recruiters, which is so exciting. They are a wealth of knowledge, and they are going to talk to you about safe to travel and some of the things that AMN does. But I'll kick it off, turn it over to Leo. You're right next to me. So Leo, tell us a little bit about yourself.
Yeah, so I've been at AMN. I've been at AMN for 4 years. I'm a senior recruitment manager. And a fun fact about me, I've been to about 15 different countries, so I like to travel, I relate to the nurses that way.
I love that. And I didn't know that about Leo, so I have to pick your brain more, Leo, after this Gypsy Nurse Live to see which countries you've gone to and which ones you love the most. But thanks, we're so excited to have you. And Miss Kelly, you are up next.
Hi, everybody. My name is Kelly. I am a recruitment manager here with AMN. I work on the American Mobile side. I have been with AMN for 7 years. And a little fun fact about me, I've actually traveled across the country twice now. So I moved 20 years ago from the East Coast to the West Coast. And then I've moved back to the East Coast this year. So I know a little about travel and can help you on your journey if I am assigned as your recruiter. So welcome.
I love it. We're so excited to have you, Kelly. And I think it's fun. When Kelly has moved back to the East Coast, she gets her Southern twang back. So I love that comes out. But Kelly, we're happy to have you. And Mary, you are up next, my friend.
Hi, everyone. My name is Mary Abramson. I'm a senior recruitment manager at American Mobile. It'll be 5 years in March. Really quick plug to all my nurses watching it on Team Mary. Hi. Fun fact, my mom has an MSN. She's been a nurse for over 30 years. My dad has been a CEO of a healthcare company, a CFO. So I was really raised on understanding both the patient side and then, the admin side of nursing. So what I tell my nurses is I've probably been in the industry since birth, no pun intended.
I love it. And for those of you who are on or are watching in the later recording, Mary is going to be at TravCon this year. So definitely stop by and see her. I'm sure that you will enjoy talking to her. She's amazing and so fun. But please be sure to stop by and see us at the AMN Healthcare booth at TravCon. Mary will be one of the smiling faces there. And then last but not least, we have Miss Sarah, who is here for all of our allied professionals. Sarah, tell us a little bit about yourself.
Hi, everyone. My name is Sarah Gold. I started with the allied side, so club staffing with AMN about 1.5 years ago, and I have loved every second of it. A big part of the reason why I love this career of mine is because I also love to travel. So it's so cool being able to get everybody out traveling while also helping a hospital that really needs help. So that is something that makes me very passionate about this. And I am a senior recruiter, so I hope that I get to help any allied professionals get into traveling soon.
I love it. Thanks so much, Sarah. I feel like between you and Leo, I'll have a really good sense of where I need to travel once COVID is over, right? Well, I will get us kicked off here. So again, topic is safer to travel and how AMN is really making it safer to travel. I think where we want to focus here is how we're really supporting you. So I think we hear safe and we think, gosh, what is safety, and how does the company that I'm working for really make sure that my experience is safe as I travel to potentially a brand new place that I've never been to. What you're going to see from us today is how we support you in preparing for your assignment, while you're on your actual assignment, getting ready for that next assignment, and wherever you are really in your journey with travel nursing. We know we have a lot of first-time travelers, and we need you. We also have our really tenured travelers who have been working with us for years and years. We need you as well. But hopefully, if you're on that borderline of whether I should travel or not, is this something that's right for me? How am I going to feel supported? We'll answer a lot of those questions during our time with you. To kick us off, we don't have any comments in the chat yet, so I do want to throw a giveaway out there for the first 6 people who comment in our chat here. So wherever you are on Facebook or on YouTube, first 6 comments will get a pretty awesome swag box. It has some goodies in there. I actually want one of these things, which every time we do these giveaways, I think, man, I really want that prize. So I promise you will not be disappointed, but there's some good stuff in that gift box. First 6 comments or questions in the chat, we'll get that. So I'll be waiting for those to come through. Jeremiah, Kelly is awesome. Yes, she is. And Kelly says hello. Throw us a question, Jeremiah, so you can win one of the prizes. Aloha from Hawaii from Cindy. So good to see you all. Give us a question, guys, so that we can make sure that we're answering what you need. All right, so while we're waiting for those to come in, I, of course, can't also start one of these without saying thank you to all of our amazing clinicians, to all of you who are on the call, all of you who will watch this later. This year has definitely been unprecedented. It's been longer than we have really ever imagined, and we're coming up against new and different challenges, and we're just so thankful for you. I can't say it enough. Can't start one of these without saying thank you. So thank you to all of our amazing clinicians for everything that you do. All right, that's enough from me. The people want to hear from all of you. So Miss Mary, I know that you are going to talk to us a little bit about how you work with your clinicians, how you get them ready to start their assignment, especially when you're working with a lot of those first-time ones. And Miss Ashley Murray, by the way, said Mary is the best. So kicking it over to you, Mary. Talk to us a little bit about how you prepare your clinicians.
So for me, that first 30 seconds on a call is really important. My first thing is, hi, this is Mary at American Mobile. How can I help? Nurses and clinicians, your job is to help. When are you asked, how can I help? So really, I think what's very vital in feeling safe, which I think is synonymous with the word support, is knowing your recruiter is listening, but not just listening, but understanding, right? As the market changes, the reason I still have a position and Google can't do what I do is because what we do is intuitive to the human experience. So I want to build rapport with you. Why have you come to me? There's always a catalyst and change in a clinician's life. And the more I can understand what you need, I can assess your needs, and then we can exceed them, right? I would say safety-wise, your biggest resource, you can read all day, you can go on different blogs, but your recruiter, right? I would say a company is only good as the recruiter you've been assigned. I like to provide a traveler handbook to my nurses that AMN has so thoughtfully put together because there's so much good info in there. In addition to that, first-time travelers, you don't know what you don't know yet, but we're going to find that out together. And as we grow through the progression of getting your file together, kind of seeing what's important to you, that's really how I dissect how to give you some info and then also listen to your feedback. It can be super overwhelming as a traveler right now, but my important part is making sure I'm only a text away and getting back to you right away so I'm hearing you.
Yeah, and they definitely do. So Mary is talking a lot about just that support, a lot of things that she does, particularly with her clinicians, that traveler handbook, which is awesome. Mary, one of the questions that we had gotten, we actually have something else here. So maybe 2 parts for you, Mary. What are some of the best places to look for housing? So if you've taken that subsidy option, and then I know one of the questions we got before our Gypsy Nurse Live was on what does AMN do for housing? How do we make sure our clinicians are safe?
Right. So I think the biggest question for me to give you what you need is you knowing what you need, right? So my job as a recruiter is to make sure if you do want to take housing subsidy in a certain community you want to assist, is making sure we're not putting you in jeopardy for that IRS to kind of be like, hey, why are you getting this much money, right? So my travelers have two choices. You can get our tax-free housing subsidy, or I always let you know that, if you're struggling with housing, you're not sure where to go or what to look for, we do have a housing department that is here to assist you. We have an after hours line as well in case anything should happen. But I do send a housing resources page. So I've collected many websites as well for housing resources, but also American Mobile has, great discounts if you're looking at an extended stay because you have pets, or, there's just so many different options, but the empowerment and the safety and the support comes from me asking you, what do you want? And then letting you know, we're going to take care of you. If, you're like, Mary, I've been looking, I'm not really finding what I'm looking for. What are my options?
Yeah. And one of the things for our housing team is that safety first. So our priority for our housing team, if like Mary said, you're 2 weeks out, you can't find anything, we've got you, we'll take care of you. But that safety is number one priority, absolutely. And then second is proximity to the facility. So we want to get you in the safest place possible, and then make sure that you can get to the facility as well. So Mary, I know you were also going to talk a little bit about how you kind of create that dream with your clinicians, or how you help them envision what that future is going to look like when it comes to travel nursing.
Yeah, so I get many nurses. I have some nurses that have been nurses for 20 years. Perm staff, never done a travel assignment. I have first-time nurses. But really what I ask my nurses to do is close their eyes and like, what do you envision, right? Sometimes it's a one-stop shop that grows into it. Sometimes it's you getting your toes wet close to home, but you're picturing that Mai Tai in Hawaii, right? We have exclusive contracts there. My job is to listen to your journey, and just remember your journey can change at any time, but that's why I'm always in conversation with you. I always want to know your dreams. And I mean, travel nursing, I'm jealous of all the travel nurses, clinicians out there because I'm like living through them, right?
I love it. And we've got some good comments. Rebecca Fraser wants you to be her recruiter, Mary. So you have definitely created the vision for her. We did get a couple of other questions. And Cindy, I'm going to ask you for a little clarification. What's appropriate when asking for RTI? Should you ask for RTI? I'm not 100% sure what you're asking for as far as RTI goes. I'm usually good with acronyms, but if you can throw that in there, that would help me. Jeremiah, hopefully we answered your question on some of the best places to look for housing. We have a lot of options for you. Mary sends that housing guide to her her clinicians. We also have that for our other recruiters to send out to clinicians. So lots and lots of good opportunities. Cindy, thank you. I thought it was requested time off, but I just wasn't sure, so wanted to make 100% sure. Kelly, I'm actually going to throw that question to you. Talk to us a little bit about time off. What do you tell your clinicians when they're talking through time off?
Well, I think it's really important that our clinicians understand that time off is extremely important. It's the quality of your life, that's why you're doing travel. But you're also there to fill the need for the facility. So there are going to be some times when you're not able to get the time off that you might need. And then there's going to be times when you get all the time off. Jeremiah, you're on here, and we thought, okay, we're going to send some lengthy time off to the request at the hospital, but they actually could approve it because they have enough staff to be able to help them through the time Jeremiah had requested those days. But there are some places that are just in dire need of nurses and do not have the ability to approve all of that time off. And there's probably been times, I've had to come back and say, hey, the hospital can't approve every day that you need off. Let's, shorten those requested days, and let's see what we actually can work with to help the facility, because you're there ultimately to fill the need at the hospital. And the joy of traveling is that you get to pick and choose every 3 months where you want to go, how much time you want to take off, where the permanent staff does not have that as an option. So just being a traveler in general gives you that flexibility to take 2 weeks, 3 weeks off, still be covered under our benefits plan if that's what you choose to do, and then start your assignment later on.
I love it. Thanks, Kelly. Yeah. So, I mean, I think just be, as Mary said, be super open with your recruiter. Let them know what's going on. Talk to them about what it is. If we can make it happen, we will. But most of the time, and really all the time, it's not up to us. We'll ask. I think being flexible. If it's a true deal breaker, just be really upfront with that recruiter of yours. They'll make sure to take care of you. So before I transition over to Sarah to talk to us a little bit about our AMN Passport app and some of the awesome tools and abilities that that gives you, did get a question from Yolanda. Any COVID vaccine thoughts? Some hospitals are saying employees have to get vaccines. We're feeling this just along with you. We know it's a very hot topic. It's something that's debated very heavily on both sides. As far as we go, we want to make sure that our client feels supported, so that the facility feels supported in what it is that they're asking for. We don't have a decision in that. If a hospital comes to us and says our clinicians need to be vaccinated, we'll give you that information. It is your decision as to what you want to do. And if it's a total no-go, we'll see where else we can find a position for you. But have to go with what the facility is asking for all of their clinicians. Cool. So other questions. Cindy threw in, AMN provides continuity of benefits between contracts. And thank you. Great answer, Kelly. Yes, we do. We're going to talk a little bit about health insurance a little bit later on. So stick around, Cindy. We will answer that question. I think Leo's going to talk to us about health insurance in just a bit. But Sarah, I'm going to transition it over to you. Talk to us a little bit about AMN Passport and how that is helping our clinicians.
Yeah, thanks, Saundra. So AMN Passport is something that we developed pretty recently, actually. It's still pretty new. And so everything is smoothing out with it. But it's awesome because it's right on your phone. So you don't have to log onto your computer to look on our website for open jobs. You have everything at your fingertips. You have 24-hour job search. So you can look anywhere, anytime, no matter what. And then it also has everybody's contact information. So not only will your recruiter's phone number be on there if for some reason you don't have it saved, but your benefits team will be on there. You're going to have credentialing. You're going to have the clinical support team. Everything is going to be on there. You can have access to your pay stubs and your time cards, and it's just super useful. If you haven't downloaded it already, I definitely recommend it if you're on assignment with us, because it's going to cut out a lot of your questions, which we will always have the answer for, like what's benefits number or what's payroll's number, but you don't have to ask because it's right there on your phone already. So that is something that is really neat that we have now.
I love it. Yes. And AMN Passport is awesome. It continues to grow. One of the cool things about it is that it has been developed by our clinicians, by all of you. We did not sit in our ivory tower and come up with what the perfect app would be for our nurses or healthcare professionals. We actually have panels and we talk to all of you about what is it that you want to see from us? How can we support you? How can we make sure that you utilize the app? So lots of good stuff that Sarah talked about, just that support team. You have more than just us as your recruiter to support you here. You have a credentialing team. You have a benefits person who knows all of the right answers to all of your benefits questions. So lots of people to help support you. But there's also more that's coming, like inputting your time and pay into the app so that you don't have to print out a time card, fill out the time card, get the time card signed, print, scan it somewhere. I don't know if people have scanners, take pictures, send it back to us, make sure that it was loaded appropriately. All of that we're transitioning to the app, which is huge. We want to make your life easier. We want to make doing business with us even easier. So AMN Passport will definitely help with that. If you haven't downloaded it, to Sarah's point yet, make sure that you do. We also, one of the things that we'll talk about here too is with technology, we want to make sure that you're feeling supported as you transition into your assignment or you're finding that assignment. We utilize virtual interviewing with a lot of our exclusive clients. Now, some of you might say, oh my gosh, I don't actually have to talk to someone. I just have to record myself. It's way better. It's way easier. It's done on your time, which is great. And with that virtual interview, we can match you up to a facility that's going to be the best fit for you. We want you to be successful while you're on your travel nursing journey. And we don't want those cancellations to come through from the facility or from you. We want you both to feel like you're in a good spot. So virtual interviewing has actually brought down those cancellation rates significantly. Comfort, support for you, making sure that you feel like you're in the best spot possible. All right, so I have winners. So winners are from my team, Jeremiah Munsell, awesome, Cindy Clifton, Ashley Marie, Martha Staub, and then Yolanda Roman. I'm going to mess up your name, Yolanda, so I'm just going to try. I'm sorry. So Yolanda, we are, and Rebecca Fraser. So great job, guys. We'll get your information from Rachel to send out those gift boxes. They're well earned and you will enjoy them, I promise you. All right, so following up that giveaway, I have another one. This one's going to require a little bit more work. So make sure that you have your phone ready if you don't already. I have 3 winners for the first 3 people to follow on Instagram, AMN Nurse. That's AMN NURSE. So follow at AMN Nurse on Instagram and comment on our post. It's a Gypsy Nurse post, so it should be pretty easy to find there. It's our first post for today. Comment, make sure that you follow us. And I have 3 winners of ClassPass gift cards for $100, which is awesome. While you're out there, no matter where you are in the country, you'll be able to find some really great classes to take to help you with your mental health and making sure that you're getting that Zen moment of yoga if you need, or if you're like me and you just need to sweat it out, you can find some really great classes for that too. So 3 winners. So if you're already following AMN Nurse, you don't have to do that part, but comment on our first Gypsy Nurse post, and we will get you a gift card. All right, so continuing on. So we've talked a lot about prepping for your assignment. Let's go into just actually being on assignment. And Leo, I know you're going to talk to us about this part, but we've talked a little bit about that support team, and I know you're going to talk to us about some insurance options, different things that we have, but I'll turn it over to you, Leo.
Yeah, so we do have a lot of different support teams for everything that you need. We do have a different support team, a different representative that will help you along the way of your journey. We don't just book you and disappear. We will be with you every step of the way through all 13 weeks of your assignment, and also to work with you on getting your next one as well. So, I mean, whenever you do start the assignment, there are a few things that I make sure that I send to every single nurse to make sure to smooth out the process for you, to make sure that you have all the information in one place. So, I mean, one of the things that I do send, of course, is payroll for timekeeping, to make sure that you're doing you have the instructions there, and also that you send in your time card to the appropriate place and time. We also, for your reimbursements for your plane tickets, or however you get to your assignment, make sure that you send that over to the right representative to make sure that we get that back, to make sure that you get reimbursed for that on a timely basis, and also our health insurance, and also our other benefits that we offer as far as health insurance, 401k. You'll be able to contact your the benefits department, and make sure that you get paid. Make sure that you select the one that you'd like as well.
You got it, Leo. And then I know that the question came in from Cindy about the continuity of benefits between contracts. Do you want to talk a little bit about that with health insurance?
Yeah, so as we were talking about time off before, so I know a lot of time people like to take a week or two in between. So even if you want to take a week or two, take a break, on a little vacation in between assignments to blow off some steam, we can go ahead and you'll still be covered with us throughout that whole time. So.
Yeah, so huge. You want to make sure that you've got that next assignment booked within a time frame, and your recruiter can tell you all about that, Cindy. But we do offer a continuity of benefits. So while you're taking that well-deserved time off and maybe hanging out, Cindy, since you're in Hawaii, I don't know where else you would want a vacation to, but you can go sip some Mai Tais during your time off and make sure that you still have that health insurance. Or maybe take up, skydiving or surfing or something. And then if something happens, you're covered, you're good. But yes, health insurance, definitely the continuity of it. And just being able to provide those benefits to our clinicians to make you feel supported, help you feel safe. And then Leo, you're going to talk to us about the other type of insurance that a lot of times our clinicians don't really think about.
Yeah, a lot of times, a lot of clinicians don't think about it or even know about it because a lot of companies don't even offer it. We actually have professional liability insurance, which would protect you while you're on assignment, especially now during a pandemic. You definitely want to make sure that you really are protected throughout this. So, I mean, I would definitely recommend that if you were to go with anyone, make sure you definitely have some professional liability insurance if you were to travel.
Yeah, something that we just are able to offer our clinicians because we are such a large company. It's something that smaller companies don't have the ability to. So great reason to be able to travel with us. And Mary, I know that you had a clinician recently that you were working with during the pandemic that this was a big surprise to them.
Totally. So, back in March, April, right, when there were all these different contracts everywhere, I had a longtime nurse of mine that brought, another contract to me. And I said, even if you work with me now or later, let's walk through this together. And what we noticed in that discussion is in fine print, it said your professional liability insurance is not included. Right. So what's great about American Mobile is we're not just thinking about like the actual time you're in the hospital, but let's say something else might happen afterwards. We're behind you 100% and we're invested in, protecting you throughout your journey here.
Yeah, and so critical and so important, especially during this unprecedented time. You don't know what's going to happen, and things happen at facilities all the time. So we want to make sure that you're protected, that you're taken care of, and that professional liability insurance piece is part of that package. So when we're looking at the entirety of you, what's important to you, what's going to make sense, some of those other things we don't necessarily talk about all the time, but are critical to making sure that you feel safe and supported. Cool. So Leo, back to you. Anything else that you talk to your clinicians about, or anything else that you do to make sure that they feel supported?
Yeah, if they do feel supported, if they want to go to a city that they don't know anyone or that haven't been to before, I do try to, chances are I do have a nurse that's there or have worked there in the past. I do try to connect them with the nurse that's currently there, tell them about the city, the facility, things on the floor, things that I wouldn't know about because I'm not a nurse, but they can connect with them and they can get more information and make them feel more at ease before they start the assignment.
And I love that. And it's so nice to be able to have some friends that are automatically kind of in your area, can tell you a little bit about it, right? And so great that you can connect those people up. I'm sure you have some good stories from your clinicians about just their connections and things that they've made. Cool. There's another big one, Leo, I think you're going to talk about with our clinical support. Always a big one for us.
Yeah, the clinical support is definitely a big one. So we have it's actually 24/7. So even after hours, anytime. I know a lot of nurses work nights. They can get off pretty late or early. They can always speak to a clinical department or nursing department. They can go with them any kind of issues or concerns they have about on the floor. They can always have somebody readily available to speak to them with any questions that they have.
I love it. And like Mary, I was born into the healthcare industry, but I know nothing really about what happens on a unit. I don't know what you as nurses or as allied professionals go through, but the clinical team absolutely does. They have hundreds of years of experience between them. So they are there to support you. We're there to be your guide to just kind of help you make sure that you get the answers. And we'll absolutely make sure that you're on the right spot. But thank you, Leo. I know your clinicians definitely feel so supported in working with you. Sarah, you were also going to talk about some of the other kind of perks of working with AMN and some of the things that we offer that are fun, but also really help our clinicians' mental state and those types of things.
Yeah, so there are so many different areas that I want to get into with this. First, we have our health advocate. So like we mentioned earlier, we have health insurance, but we also have a phone number for a health advocate, which is somebody who can really look at you specifically and your health insurance plan, if you choose one, and help you with any kind of billing issues. They can help navigate. I mean, I don't know about you, but whenever I'm looking to find a doctor or something, I get a little overwhelmed. So they help with that. They help you find the correct, like whatever you need, dentist, eye doctor, anything like that. They help you with basically just look at them as your assistant is how I would like to explain it, because they can help you with literally anything that you need. And then also we have an employee assistance program, which is really helpful for, we have free sessions. I know we are going to get into the happy stuff, but we are very busy and everybody is working so much. So burnout it is a thing. And we want to make sure that our travelers aren't getting overwhelmed and they're actually getting the rest they need and the mental support that they need. So we have that option, as well as the EAP programs. They can help with happy things too, like planning weddings. They can help you figure out a good way to make major purchases, save towards your future, find childcare, find pet care, stuff like that. And then if you're not a traveler with us, something you should know is that since we're such a big company, we have all kinds of discount codes. So you can get discount codes for gyms. I think it's like Disneyland, Universal, all kinds of amusement parks. There's Costco, there's LASIK eye surgery, which is huge. We also do pet insurance. I think it's through it's one of the major pet. I use it for my puppy, so it's pretty big. And then we have phone service discounts, hotels, rental cars, literally everything you can think of, cruises, anything you need a discount for. You should check the link that you're going to get sent in your welcome email because it'll help. It'll be
There's
there.
some good stuff in there. There's so
Yeah.
much fun stuff. There's happy stuff. But there's stuff, like Sarah said, to really make sure that you're taking care of yourself. The COVID burnout is real. We feel it. We know you feel it way more than we do. So we want to make sure that your mental health is well taken care of and that you feel good when you're on assignment, when you're off of that assignment, planning for the next one, whatever it might be. So all of those services we offer to you. Some great comments in here. Miss Ashley Marie, I have only worked with AMN. I never needed to look anywhere else because everyone is so helpful and prompt with their responsive, impressive customer service for such a big company. So thank you, Ashley. We love hearing that. That is our goal. We want to make sure that you're supported. We're responding to you when you need us, and we're here for you. Cindy, I also love your comment. I'm on assignment and want to stay here and get scuba certified and then start another contract. Girl, I am all about it. I'm going to come visit you. That sounds amazing. Steve, hopefully you're getting all kinds of good information. So thank you. Great session. And Sherry, we'll get more information for you on the clinical support team. We are always looking for new nurses to help us with that. So we'll get more information from you. I'll have one of my team here jot down your information so that we can get more. I also have winners for our Class Pass gift cards. Simone, Ashley, and Sabrina, congratulations. Make sure that when you're taking those classes, you're taking pictures and tagging us on @AMN Nurse because we want to see what you're doing. Don't worry if you're a little bit sweaty, that's okay. We all get that way. And that means you had a great class, right? So congratulations, ladies. We will get those gift cards to you. All right, so transitioning into our last segment here, I have a big giveaway. So this is going to be our last one for today. So our big giveaway, I have 2 grand prize winners. It's going to be a raffle. So if you're not the first person to do it, that's okay. You could still win. It's going to be a raffle. So we'll have those winners later on. 2 grand prize winners. Guys, we're giving away Apple AirPods Pro. Really awesome, as well as an iPad. So 2 winners, you could win the iPad or the Apple AirPods Pro. All you have to do, grab that phone, follow and tag @AMN Nurse in your story. Just say that you're attending Gypsy Nurse Live. Grab that phone. Guys, let's give them a good smile so that we look cute in the picture. So hopefully you got that picture. Go ahead and take that picture, put it onto your story, make sure that you're following AMN Nurse, and then tag us @AMN Nurse. That's AMNNURSE. We'll have 2 grand prize winners. It'll be a raffle, so if you're not the first, don't worry. Jump in there, and we'll make sure to announce those winners later on. But all right, we're going to transition a little bit. Kelly, we got a ton of questions on COVID, which is not surprising. I know that safety with COVID has been top of mind. It's top of mind for us. It's top of mind for you. It's something that's seemingly very unknown, especially as we're transitioning into this post-initial COVID, now potential variants, all of the things that are happening. The industry is changing and has changed. Some of the questions that we got that we'll answer in this section are, do you offer paid time off if I get COVID? I've been vaccinated for COVID, but what if I get it and can't work? What separates you from other agencies when it comes to safety? So Kelly, I'm going to transition to you because I know this is something that we've lived and breathed the last longer than we want to really even believe or admit to. But I'm going to transition it to you to talk a little bit about COVID and some of the things that we've done for our clinicians.
Okay, sure. Yeah, so COVID has changed every industry across the world. We are, there's no question about that, especially the healthcare industry. And it's really made AMN stay on top of our safety procedures, our crisis plans, and just ensure that all of our clinicians really feel supported and safe, like Saundra said, throughout their entire tenure here with us at AMN. So, I'll just jump right into kind of how we handle the COVID situations if you are on assignment with us for some of our, newer nurses. And one thing I do want to shout out is last year we had, I don't even know, thousands of new applicants that had never done travel nursing. So it was really exciting to see these nurses they had just either gained experience, fresh out of school, gained experience on their units for 1 to 2 years, and then were ready to kind of jump in and do the travel nursing journey. Or we've had permanent employees that have left the hospital and wanted to help out in other communities that they knew really needed their support. But it was cool to see so many new applicants last year because we know there's a nursing shortage. We know there has always been a nursing shortage, and there probably will never not be a nursing shortage. So with those new applicants that could start within that certain time frame, we gave them a really cool gift of iPads so they could communicate with their families while they were on assignment. And to me, I just thought that was really cool because that was just like an added perk that AMN offered. And especially as a new traveler, you're just kind of, getting your feet wet and learning about the experience. So you do want to feel like you're still connected to those family members. So that was cool. Yeah. But if you are exposed to COVID while you're on assignment, we take care of you 100%. So we have a number that you call in. You'll probably reach out to your recruiter, let them know that you're having symptoms or there's something that you're going to get tested. It's always important to always communicate with your facility. They need to know as well, just as much as I, as your recruiter, or any other recruiter. It's always important to communicate with your staffing team. Let them know, then you call into our hotline, we take care of you. We get you connected to our clinical support representative. They ask you all the questions. They tell you all the answers that you need to hear. They start messages with payroll, but we will take care of you. Typically the quarantine timing is 10 days. So we'll cover your pay for that time. And then if there is anything additional, like you're still feeling sick or there's something else, then we connect with workers' comp and they continue to handle the case for us at that point. But I would say 98% of the time we're good and you're back on assignment after those 10 days of quarantining. So it's really nice to know that, we have a hotline for you to call into. We'll pay you for your time that you're sick. And that we do have a workers' compensation line that will also be able to assist you. And that's just in anything. You get pricked on the finger with something, somebody tests positive for TB, you got to get tested. All of that's for workers' comp, and we have that whole communication with them or can get you their information.
Yeah, and such a big thing for our clinicians to feel supported and make sure that they have all of those additional benefits that you probably have while being a perm staff nurse or allied professional or surge tech or whatever it might be that you kind of forget about. We want to make sure that we've taken care of all of those things for you so that you feel good. I think one of the other things that we're going to talk about is there are disasters and things that happen outside of COVID, even though that has been front of mind. I'm going to turn it back to Kelly in just a second, but one of the questions that we had gotten as well was on anticipating or an action plan for a second wave of COVID. And I think one of the unfortunate things for us, having gone through this past year and a half of height of COVID, coming down from it, going back up, seeing all of the responses, the facilities on hiring large amounts, then canceling people, and then needing more people again, our clinicians catching COVID, needing to be hospitalized, coming out, needing to go back to assignment, is that we've been able to create this playbook of how do we handle each of these different scenarios so that when we do see something like a second wave of COVID or another unanticipated pandemic or crisis that we potentially didn't see coming, we know how to handle each of those scenarios because we've lived through them with you. And we've been able to pull resources, make sure that we have people hired to handle each of those different areas and help you through, help us through whatever that might be. So I think in this past year and a half, the fortunate piece is that we've been able to really create a guide for us on how to handle situations like this in the future, so that you feel safe, you feel supported with traveling, especially being that boots on the ground and actually being at facilities. We want to have answers for you, and we want to make sure that you feel supported. So with that, Kelly, I know that you have done a ton of work with us on crisis communication, on what happens with those other things in life, again, that we've kind of forgotten about during COVID, but fires in California, hurricanes on the East Coast. You want to talk to us a little bit about that?
Yeah, definitely. I think the number one thing for us, is that we work with the local authorities, we work with the hospitals, we work with the police department, the Chamber of Commerce. We really make sure that everybody in those areas that we have nurses or clinicians, they're protected and, again, safe. So we partner with them. We send out messaging to make sure that you guys get the latest up-to-date information on, what the scenario is in your area that you might be. A few years ago, we've just continued to have fires in California, so that's, probably really not going anywhere. But we make sure that if our nurses and clinicians in those areas are affected by the fires or hurricanes, we are there to support them, whether it is a call from the recruiter. Years ago, we set up stations to where we could give supplies to our clinicians that were in the area of Santa Rosa and Napa. A lot of those clinicians were misplaced from their homes. And so we had to help find them. We got them hotels. We helped cover their compensation. If they weren't able to get to another area, a lot of our nurses still wanted to work and were like, how can I help? What can I do to be a resource, for the area? So we were able to assign those clinicians to new facilities to work at through the fire situation, which was amazing. They got bonuses to do that just because they are amazing. We supplied scrubs, shoes, every little thing that we can do to help while you are on assignment with us, we are going to do. And it goes all the way up to our CEO. Everybody's involved from every level. So it just makes me really proud to work for a company that does that, because, you just want to hear that everybody is involved in making sure that your clinician's experience is important, just as important it is as me as your recruiter to you as just, the CEO of the company. And we got a lot of wonderful responses, through social media and stuff from our clinicians saying that they were really happy with the way that we've treated them and been able to really help them through these times, especially the pandemic. We offered a kit once, they started their assignment where they got masks, gloves, sanitizer, wipes, things that were just little things that make a difference that you might need while on assignment. So like I said, no detail is left. We really care about everybody and want to make sure that you're supported. If there's a crisis happening or not a crisis, we give gifts whether there's crisis is happening or not. So that's another perk of working here.
We definitely don't want it to just be because of crisis. We do appreciate you, pandemic or no pandemic. And hopefully that's the theme that you're starting to see, is that there's a lot of stuff that we want to do for you to make sure that you feel supported. Traveling, as fun as it is also difficult every few months to pick up your life and move to someplace new. And we want to be there with you for the fun and exciting parts, but also the hard parts of it to help you through whatever that might be. Sarah, just to keep us light, I'm going to turn it over to you to talk about some of the fun things that we have been able to do for our clinicians over the past year, but things that we're also continuing forward with. You want to talk about some of that?
Yeah, absolutely. So I'm going to start with something really neat that we did that I actually loved. Some of my travelers got this, and we didn't even know it was coming, which was the best surprise about it. Was about a month ago. I guess it's still kind of in the process, actually. As if our travelers worked 1,000 hours within a certain period of time, we gave them $1,000 bonus, and we also let them choose a charity to donate $1,000 to as well, which I thought was so cool. I'm very passionate about supporting communities in need. So I love that we let our travelers, pick where their money, like not just their money, but the money we're donating, where it goes to. So that was really cool. I'm going to shout out a couple of my travelers who did get that. I have Jackie Guru. She is a respiratory therapist she's a really hard worker, and it was very well deserved. And then I've got James Cantos. He is a medical technologist, and he's been with us for a little bit over a year, and he is fantastic. He is always willing to help when needed, even if that means shuffling up his shifts just because. And then one of my phlebotomists, Jerice, she got it as well. So it was just a little token of our gratitude to say thank you to them. And nobody knew it was coming. I didn't even know it was coming until it was out. So that was awesome. But we also always send, like Kelly was saying, we send gifts out all the time, just little things, blankets, mugs, cups. I think there's like a diffuser that gets sent out sometimes. So, and then while you're sick with COVID, or if you are sick in any way, we were sending out soup baskets, and we were hiring dog walkers in case you were sick and couldn't walk your dog, and just sending gift cards so that way you could get, food, because if I don't know about you, but when I'm sick, I am not cooking. So those are just some little things we try to do to make sure that our travelers are, not alone, because being out there by yourself can kind of be a little bit scary sometimes. So we're just a phone call away.
I love it, Sarah. And I don't know about all of you. I am in my 30s, and when I'm sick, I still want my mom. I just still want her there. So the best that we can do for you is send you a soup basket, so you have some delicious chicken noodle soup to just help you. It's like our way of sending your mom to you, or just giving you a hug. And we just want you to feel that from us and just feel supported. I do know, Kelly, you had some clinicians who received the 1,000 hours bonus that you wanted to shout out to.
Yeah, two of my travelers, when I used to be a director, and then I took a step back and got back into recruiting because I wanted to spend more time with my son. And I had acquired these travelers from one of our training specialists, shout out to Andrea. And these two travelers have always worked so many hours all the time, Michael and Terry, and they just continue to amaze me. But it was no surprise when I saw their names on my 1,000 hours list, and I was just excited that we were, giving them something a little extra, because they really do work so hard all the time. So I was happy to see their names on there.
I love it. And Mary, I know you had a couple that you wanted to shout out to.
I do. So I have a longtime traveler in Maryland at our MedStar right now, Thomas Coker. He was one. A newer traveler of mine, Sandra Mayola. She's in Emory. And then one of my longest travelers, I'd say, is Rosita Louderback. She reached out to me right when Mary Washington and Fredericksburg, Virginia was doing their EMR conversion. And she's back there right now helping with COVID. Thank you, guys.
I don't think you could get enough thank yous from us. We appreciate you all so, so much. Hopefully through the course of this 48 minutes, almost an hour that we have been spending with you, you're starting to really feel that support and what working with AMN feels like. You heard straight from all of our recruiters the fantastic things that they do to make sure that you feel supported. And we want to continue to do those things. So I'm going to actually bring Rachel back up. We don't have our two winners yet for our big giveaway. I'm thinking, Kyle, maybe we can let it run a little bit longer, and then we can pull winners who tag us later today, who maybe watch the feedback. So we'll let this last giveaway run a little bit longer. But thank you guys so much for having us. We've enjoyed the time with you. We hope to come back again. And Rachel, I'll turn it back over to you.
Yeah, definitely. Thank you so much for all that information. Hopefully more people feel comfortable and comforted and, are excited to get out there and, start traveling and everything. So thank you guys so much. We'll definitely have you guys on again. We love having you on. So yeah, everyone, even though it's over, if you're watching this later, definitely participate. We'll send the comments over and definitely you can be entered in that giveaway. So thank you, everybody.
Thanks, everyone. And don't forget to visit us at